October 2022 was supposed to be an exciting time for one Maryland couple. They were about to welcome their first child. The couple wanted to have a home birth, so they hired a midwife. But they claim their midwife provided insufficient care, which drastically changed their path to parenthood.
That midwife is now being investigated by state regulators and faces disciplinary charges. But the couple tells our Marcella Robertson their search for accountability and justice has been slow.
This memory box holds the few pictures Janelle and David Burns have of their baby.
Handprints.
Janelle gave birth to their son, who they named Onyx, in the living room of the couple's Crofton home in October 2022.
During my second trimester.
Onyx was stillborn.
This is all of our special memories.
The Burnses say the decision to go the home birth route came from the staggering maternal death rates for Black women in hospitals.
We didn't want to go into appointments and be rushed or have our health concerns not addressed, have pain not be addressed.
They interviewed 6 midwives. Kai Parker was their top choice. State records show at the time Parker was a licensed naturopathic physician and midwife in Maryland, even once the chair of the state's midwifery committee. And Parker was Black.
Because Kai is an African-American woman, I knew that she would understand the experience of, an African-American woman, and she's also a mother.
They paid Parker's $7,500 fee, but instead of the many appointments promised in their home birth package, the couple says they only saw Parker in person once for a prenatal checkup. All other appointments were virtual, with David checking for a heartbeat.
That pressure shouldn't have been on me as a first-time dad or my wife as a first-time mom. We paid a medical professional. She should come in and work the tools herself.
The couple didn't know it at the time, but Parker's license to practice naturopathic medicine expired during their pregnancy. When Janelle went into labor on October 29th, only Parker's midwifery license was still active. According to medical records the couple gave WUSA 9, Parker documents arriving at the couple's home at about 11 p.m. on the 29th. Maryland law requires all midwives to have an assistant with them for home births. They say Parker came alone.
Nobody.
It was just her by herself.
In Maryland, the Board of Nursing oversees midwives, while the Board of Physicians regulates naturopathic doctors. In complaints to both agencies, the couple details the moment Parker had trouble finding their baby's heartbeat.
When I got into the birthing pool, she checked Onyx's heart tone with the Doppler at that moment. That's when she said to us that she was having troubles finding his heart tone.
David says Parker asked him to try.
She said sometimes, her fathers have better luck.
But midwifery regulations state 911 should be called at the first sign of fetal distress.
At some point, when I put the Doppler on her, we heard something, and she said, "There we go."
On October 30th, Parker documents Chanel's water breaking at 1:55 p.m., then seeing meconium, a baby's fecal matter that can cause an infant to suffocate. Parker calls 911.
She told us not to panic, that she needed to call the EMT or the ambulance, call 911, so that they can be here to resuscitate Onyx if necessary.
Janelle gave birth to Onyx just as EMTs arrived. He was unresponsive.
We're both trying to call out to Onyx and tell him to breathe, and so the whole time we're trying to yell out to Onyx, my husband is crying and hysterical, and it was just one of the worst moments of my life.
I saw my whole family break that night.
Onyx's autopsy report doesn't pinpoint an exact cause or time of death, but the report does note the baby's skin was peeling, a condition doctors say means he likely died hours before he was delivered. But Parker consistently documents hearing a fetal heart rate. Medical records show the only time she indicated otherwise was seconds before calling 911.
We have a room full of baby stuff where the wall had Onyx's name on it. I couldn't go in that room for a year. I couldn't even go in. My wife couldn't even open the door.
Looking for answers after their son's death, the couple went to state health regulators for help in early 2023. For months, they heard nothing, until the Anne Arundel State's Attorney's Office also asked regulators to look into the Burns' complaint. Then, on January 10, 2024, more than a year after their son's death, the Board of Physicians barred Parker from practicing naturopathic medicine in Maryland. 8 days later, the board charged her with misrepresenting herself and practicing without a license. We tried several times to reach Parker by phone and email to ask her about these allegations and the board's decision. We have not received a response. In these charging documents obtained by WUSA 9, the Board of Physicians found Parker continuously gave Janelle Burns medical advice as a doctor, even though her license was expired. The documents also claim Parker saw at least 4 other patients for pediatric newborn appointments without being licensed by the board.
I honestly am fearful for anybody who comes into contact with Kyle Parker from this day forward.
These charges only address Parker's naturopathic license. The Burnses are still waiting for the Board of Nursing to look into their complaint against Parker's midwifery services.
The hospital did these for us. It was inspired by the theme of Onyx's room.
An investigation that could take years to complete.
We will love you always and forever, baby Onyx.
As the board works through a massive backlog of complaints.
I'm just praying that no other family has to endure the pain that we have, but I feel like it's almost inevitable.
Parker has a disciplinary hearing set for the end of the month with the Board of Physicians. Meantime, the backlog of complaints at the Board of Nursing, that stems from a 2021 data breach. A recent analysis of the board notes it would take 5 years to clear its backlog of complaints if no new complaints were filed. And it is taking months to even look at some of the highest priority complaints. A spokesperson tells me the board has made changes to address the problem. But somewhere in that backlog of complaints, there are allegations from other families who hired Parker. They say Parker took their money but never provided the midwifery services they paid for. You'll hear from those families tomorrow night at 6. Marcella Robertson, WUSA 9.